Writing a case report. How do you do it? What do you do and where do you get started? As I mentioned before, we're going to be breaking this up by colors in order where you should get started. But the first place where you should be starting about a case report is not the abstract, is not the introduction, not the discussion section, but the actual case report presentation. When you're on your wards or whether you're actually managing a patient, something that you will see is unique cases. That naturally occur in the hospital. And they don't have to be specifically about COVID or they don't have to be specifically surgically related, but they do have to be something novel. And the best way to go about it is to see how much literature has been published on it, but also to consider that even though your particular case report may have already had something similar published to it, perhaps you can offer a new insight as to what is happening with your patient. So to begin, to write a case report, you need to start with case presentation. And the best way to go about it is to see what's been written about the patient that has entered your clinical practice or a hospital setting. And so here, without disclosing the patient information, what you would like to do is talk about who the patient is. So in our case, it was a 64-year-old male with a past medical history significant for hypertension and porphyria fulminans, presented to emergency department complaining of lower back and hip pain. What we established here is essentially the history of present illness, and you go into detail as to how they presented. You talk about HPI, review of systems, physical exam, and things like of that nature, where you give a sufficient enough history as to what has happened with the patient. So this portion in yellow, as you can see, it was everything that focused essentially on history of present illness and getting the story of the patient. So this should be your first paragraph, and it does not have to be as long as mine. It may be shorter for some other people, but depending on what you're talking about, this for sure is the story that the patient came in with. The following paragraph that I often discuss is what I've just mentioned as a physical exam, specifically in green. How are the patient's vital signs? Can you palpate pulses bilaterally for this specific patient? Do they have a full range of motion? What you're talking about here is pertinent positives or what should be discussed in such a case of a patient that is coming in for your specific case. And so the second paragraph really it has to do with the physical exam as well as the vital signs that the patient has come in with. The following paragraph that I often like to describe has to do with initial laboratory workup. What you do is typically go into the laboratory workup that the patient has gotten. And it doesn't have to be particular in a specific order that, hey, you need to have your complete blood cell count here or, your complete metabolic panel. You should be able to select specific things that pertain to your patient and also list their normal values. Now, most of these lab values, as you will see, some of them are abnormal, but other of them are normal, which you would expect to be abnormal. And so my urge to you is that you find a perfect balance as to listing what you have. If you would like to go with a safe, better safe than sorry strategy, you would like to list more things as what has been done to the patient. So this has to do with this portion right over here. Now, in this section also, if your patient has interesting studies such as an ultrasound or a chest x-ray, those are other things that you have over here and you go into those in details. And so you kind of have between these three paragraphs that we've just described, you had the story that happened here in the first paragraph highlighted in yellow, and then you go into the physical exam, laboratory, and imaging. Your transition after that then comes to the third day for this particular patient or the progress. Now, some patients may be in the hospital for a very long time. Others are there for a very short time. Whatever the progress is for you, you have to list it in an adequate point of the story where there was some change or there was some particular new event that occurred with the patient. You should not be listing on the hourly basis of what's happening, but you do want to mention the big highlights as to what was happening with the patient. And that will be more evident to you as you read throughout the patient chart as to what was happening with them. So in my instance, it was on the third day here that this was something particularly interesting was happening with them. And what I will talk about much later in the case report in the discussion section will be the protein S activity level as we take a look at the patient's laboratory. But this should not be particularly standing out in the actual case report presentation. You should be listing it as part of the values. You're trying to present a story because we're simply will be discussing that in very heavy detail come discussion time. But when you're writing the case report, you would like to list all the things that are pertinent, and perhaps there's something that you as a clinician may have found, hey, this is interesting, but there's somebody else that will read your case report and find another lab value very specific. Perhaps there is a specific finding that, the p-ANCA enzyme that listed here will be later found to be the culprit. That it is decreased. And so, you're trying to present a picture in order for others to then take a look at your clinical case report and perhaps combine many of them together. Now, at this point, you can, if this is the big finding on day 3, then you can stop here. But if you have additional days, you can go ahead and keep continuing with these. And so in our instance, we followed up on day 6 when this was essentially a big finding. And this was essentially the transition point as to what we found. And in our instance, if we're listing the figures 1 and 2, these are essentially the pictures of the fingertips. We'll go to them in just a minute, but you're essentially talking about what happened on 6th day. And ultimately, in a medical case report, the standard procedures such as debridement of the necrotic tissue and amputation, it is not so novel in order to go into great detail because it is a procedure that most clinicians are familiar with. But you still want to mention the outcome as to what happened with the patient. But the main interest for us was recognizing what was happening with the patient. So you were trying to present the clinical picture in this instance. So going into figure 2 and figure 1, here essentially you list some figures that essentially talk about the patient pathology and what happened. So this was the day 6 picture that we had in the patient chart, and naturally the dry gangrene of the hand that you're able to visualize here. This part presents naturally the way to write the case presentation of the medical case report.